So we've talked about the first four steps in writing a standard and a good health plan for year 2026. We stopped at break the year into seasons. This will help to make your plan flexible and realistic. Let's go to step 5. Design your core health pillars. Using these 5 pillars I'll tell you about. Pillar 1 is nutrition. For a diabetic patient, what are the foods you should eat and what are the food you should avoid? I'm sure you know them. Please form your health plan and put into consideration all these things. Pillar 2, exercise and movement. You should have a plan to exercise. Number 3 is sleep and rest. Adequate sleep and adequate rest is very, very important. Put that into consideration. Pillar 4 is your mental and emotional health. This year, please be a bit selfish in taking care of your emotional and mental health. It is a healthy mind. It is an emotionally sound mind that can actually help you to think and plan appropriately in order to achieve all other goals that you have set for the year. So it is very important that you work on maintaining your emotional and mental health. And pillar number 5 is preventive care. You need to schedule health checks this year. Put it in your calendar. When will you be going for your annual check? Keep track of your health indicators. What's my blood pressure? You should have a book that you write all those things inside. What's my blood sugar level? Please write it. What's your cholesterol level? All this should be documented. And also, do not ignore warning signs. If your body is telling you something, please pay attention to it, no matter how little it is. Step 6, create simple daily and weekly routines. Create simple weekly and daily routines. Part of it is setting daily water goals. I should take at least 6 glasses of water in a day. The goal is actually 8 glasses of water. But even if you can't meet up to 8, please take at least 6 glasses of water in a day. Here in Nigeria, we talk about sachets of water. Pure water is 500 ml, and that's the volume of a standard glass cup. Ehen. So you should take at least 6 sachets of water in a day. If you can take 8, good. Now, you should plan to also have 10 to 15 minutes of quiet time daily. When I say quiet time, what comes to our mind most times as Christians is the time you spend with God. If you are not a Christian, you can spend that time meditating, you can spend that time just relaxing and reflecting on something. So you should have at least 10 to 15 minutes of that time in a day. Another one you can plan is about working out, exercise, as I said earlier. And then weekly meal planning. Plan your meal for the week. What are you eating on Monday? What are you eating on Tuesday up till Sunday? The last I want you to note is that consistency beats intensity. Every day, every time, you should work on being consistent. Instead of just saying, today I must take adequate diet, what we call balanced diet. You shouldn't just be focused about today. Be focused on every day of the month, every day of the year. So it is very, very important for you to be consistent. Step 7 is that you should track, reflect, and adjust on a monthly basis. Pick a day of the month where you will sit down and assess your health status. You can pick the first day of every month or the last day of every month, or you can pick the day of the month that is your birthday. For example, I am August 28th, so I can decide to be doing my assessment, my reflection every 28th day of each month, like 28th of January, I'll sit down, assess how far I've been able to go with my health plan. 28th of February, I'll do the same thing. 28th of March, I will do the same thing. So pick a day that you know you will remember and assess how far you have gone every month. Ask yourself, what worked? Number one. Question two, what didn't work? Question three, what needs adjusting? And adjust as necessary. Step 8 is that you should build accountability and support. You can do this by sharing your health goals with a friend, or you join a community and share your health goals with that community so that you can be held accountable. Number two, you can use a habit tracker or a journal. You document on a daily basis, you document on a weekly basis, and at the end of the month, you also sit down and document how far you've gone, what needs to be changed, what needs to be continued. Then celebrate small wins. Yes, if you have been able to go through a week eating healthy foods, taking water as you should, exercising as you should, maintaining your mental and emotional health, then you should give yourself a thumbs up. Celebrate yourself. Very important. So, in conclusion, I want you to know that having a health plan is not punishment. It is actually self care, and it is self respect in action. So, in year 2026, please do take care of yourself. I wish you a healthy year 2026.